Hey guys, Dr. Regetz here to talk to you today about the importance of rechecking. So rechecks are a form of exam where we do just that. We recheck the patient to check on disease status. So for example, say your puppy came in and we had a bout of GI disease and we ask for you to come back in a week to do a recheck of the status. That's because our patients don't talk, unlike us. So while we don't necessarily go back to our doctors for rechecks, it's super important for us to see the patient back to assess if the disease status had changed, as in, has it improved and we're resolved? Has it stayed the same and we need to figure out more about what's going on here? Or has it actually declined and we need to kind of put our heads together to figure out what do we do next to make sure that our little fuzzy friends feel even better. It helps us to make medical adjustments. So we use the things you're telling us that are going on at home, plus the physical exam, plus diagnostics to figure out, well, how can we better manage this baby and how can we get some resolution and relief for this baby? Rechecks are also super helpful because sometimes we figure out other things that are going on so we can address problems sooner. I know that some of y'all have been in exam rooms with me and I explained to you the importance of our yearly exams, but the rechecks are just as important because for us, 1 year is 1 year. But for our babies who only have like a 10 to 15 year lifespan, 1 year is so much more in depth than just 1 year. 1 year is like several years for us metaphorically, and a lot can change physically for them and health-wise for them. So when we come in for our rechecks, I'm really able to figure out, is there any changes and adjustments? Something as simple as a weight gain or a weight decrease really kind of tells us about the overall health status of the patient. It's also a great value to y'all. So think about your hard-earned money and how much you love your babies and you want to make sure that everything's good. Well, when you come in for their sick exams, you're paying a fee. And we want to make sure that whatever was sick and whatever made them feel bad has resolved. So when you come back in for their recheck, you're getting the full value of your sick exam overall. You get to speak with the vet. So you get to speak with me or Dr. Line or Dr. Patton. You get to pick our brains. You get to tell us more about the story overall. And that helps our patient, say it's fancy, feel better. It's expert advice. You know, we went to years of schooling for this. We have a lot of information under our belt to try to help you help your pet to the best of your ability. And this way, you know that it's coming from us. It's the truth. It's not necessarily something somebody just posted on Dr. Google or on Facebook or whatever. Another added benefit people don't think about though is socialization. So every time your puppy or your kitty comes in here, it's one more event they've come into the vet for. So they're getting more and more used to it. And it starts to kind of make it so that the vet isn't always a bad thing for them. They get treats, they get loved on. I'm sure y'all seen us out here with the peanut butter, left, right, and center. And just making sure that we're getting them in here because mental health, behavioral health is just as important. So just take all of that into account. We want to make sure that your babies are as well loved and as well healthy as they can be. Time is valuable for y'all. I know it is for us. So please keep this in mind when we schedule these rechecks. We really want to see these guys in. If something happens and we're unable to because your schedule changes, or maybe the patient's completely resolved and you just don't see the benefit, then just give us the courtesy of a call. We really appreciate that because that frees open a slot for another baby to get in here that we can help. Another added benefit for all of us today with these many busy schedules we have is what we call telemedicine. Telemedicine is basically this. It's us FaceTiming. It's us looking at each other through a video web camera to try to assess what's going on. I can actually triage the patient that way. Maybe you have a question where you're like, you know, X, Y, and Z is happening, but I don't know if it's worth coming into the vet for. Or, hey, I don't get off work till 6. Can I just chat with you about this? Then we have this great app. It's called AirVet. So air as in the thing we breathe and vet as in what I am, a veterinarian. And it really just allows us to FaceTime. Sometimes we ask you to put the patient on camera so we can see whatever behavior or change or sickness you're seeing. And then we can advise you medically what the next steps are that are more appropriate. It's efficient, it's effective, it's quicker, and it gives us this great face value. And for those ones that get nervous getting in the car, or maybe they don't like coming into the vet, that's another good option. So whether it's rechecking in person or trying out our new app, AirVet, we definitely think that it's never a waste of your time or money, and it's always in the patient's benefit.